Tamoxifen and aromatase inhibitors. Today we will be discussing these two commonly used drugs in breast cancer, the benefit they bring, but also those side effects that make tolerating them for 5 years so difficult for patients. I'm going to share with you the natural compounds and strategies we use so you can tolerate them and claim the full benefit. Stay with us. Welcome back to Oster Oncology. I am Dr. David Oster. We are in the month of October. It is Breast Cancer Awareness Month, and so we are focusing a lot of our videos right now that we're putting out on breast cancer, all aspects of treatment and care. Today we are going to be focusing on two classes of drugs that are commonly prescribed in breast cancer, tamoxifen and aromatase inhibitors. These are also called endocrine therapies or anti-hormonal therapies. They are used in estrogen positive cases, and that means that women that have it's been confirmed from their biopsy or their surgical results that they have identified one of the survival skills that their particular cancer seems to have acquired is an exaggerated ability to harness and use estrogen for, again, exaggerated growth and division. And so there's some particular biology to that, but essentially breast cancer cells have receptors on them for various external signals, and estrogen in the circulation can be one of those. And so on the surface of a cell, we can have receptors, but also estrogen receptors can also be found just inside the cell as well. And when they are engaged by estrogen, then they send a signal internal to the cell, and in normal cells it's good. It's saying, hey, be healthy, grow, execute the functions you need to really provide health to the tissue that you're a part of, the breast tissue. The problem arises when that survival skill is exaggerated. It's basically hijacked by a cancerous malignant cell, and again, that advantage is overreaching, it is exaggerated, and the stimulus and the exposure of that cell to estrogen really causes rapid division and growth. And so we see this in 60 to 70% of cases of breast cancer are hormone positive or estrogen receptor positive. And so it's in these women, which is the majority, that we see after definitive treatment has been given in early stage, which would be surgical, of course, and then either pre and post treatments afterwards, perhaps radiation, we find the recommendation for these two classes of drugs being given. They are also considered sometimes in metastatic cases, so the aromatase inhibitors are also considered in metastatic cases. They're often given with CDK4 and 6 inhibitors, so Ibrance or palbociclib. You may be undergoing treatment with an aromatase inhibitor in one of those as well. Tamoxifen is sometimes given as well with a drug called Zoladex, which decreases ovarian output of estrogen as well, and that is coupled with the actions of tamoxifen. So sometimes you'll find them in combination. So what we're going to focus on today in this brief video is the side effects that we know come from these drugs, and then what are the remedies? How can we actually increase tolerance so that you ladies that may be facing treatment or walking through, maybe you're a few years into treatment with these drugs because they are given for at least 5 years. If you are struggling, and they can be a struggle, certainly, then I want to give you some hope. There's a lot of things that you can do to increase your tolerance and be able to stay on that treatment for its recommended time, which is again that 5 years, so that you can claim all the benefit that we're hoping to get from it to decrease the risk of recurrence of disease. So the mechanisms of action, they do different things. So tamoxifen is typically given in pre-menopausal ladies, and this is because the primary source of estrogen production is still the ovaries. And again, Zoladex can suppress that, but typically tamoxifen is given on its own, and it does nothing to the production of estrogen at the ovaries. What it does is it directly engages the estrogen receptors on cells, healthy cells and abnormal cells, the malignant cells. And so what it does, it basically blocks them. So it will, on the receptors on the surface of a cell, it will bind onto them and compete with circulating estrogens and basically say, I'm sitting here instead of you, and the cells are therefore starved particularly the malignant cells, are starved of their favorite fuel source, which has been identified, which is estrogen. And so that growth signal, that exaggerated response from estrogen binding a malignant cell, is blocked by tamoxifen. So again, tamoxifen's mechanism of action, where it works, is right on breast cancer cells directly, okay? The aromatase inhibitors, they are used differently. They're used typically in postmenopausal women, and this is because the physiology has changed, and we see that aromatase inhibitors, actually we're getting better response in postmenopausal patients versus in comparison to tamoxifen's benefits. So aromatase inhibitors are used in that setting, and in that setting we know that the primary source of estrogen production is no longer the ovaries. So postmenopausal, the primary site of estrogen production actually is in the liver, and also a lot of it is actually in the excess body weight that we're carrying, the extra fat tissue, the extra adipose tissue. In the liver, in the fat tissues, in the fat cells, there's a little enzyme that converts other androgens, other hormones like testosterone. Aromatase inhibitors can take testosterone, and it readily does this, and converts them into estrogens. Okay? So aromatase is found in the liver and the fat tissues, and it takes other hormones from the body and it makes estrogen. So these other sites where aromatase is found becomes the primary factory to make estrogen. And so aromatase inhibitors are drugs that do not directly engage a breast cancer cell somewhere, if there is one in the body. It doesn't engage it directly like tamoxifen would. What it does, it goes to these other sources. These aromatase inhibitor drugs blocks estrogen production at these other sites. Okay? Lowering again the production, lowering the exposure of estrogen to potentially a cancer cell that's still remaining in the body after you've received your definitive treatment. So the mechanisms of action are different depending on where we are at menopausally because the physiology changes, okay? So the side effects that come from these, though, they can be, it's funny, every woman's physiology is different. Some ladies use these drugs and they don't really have any issues with them, and they say, oh, I'm fine with this. Other ladies really struggle. The side effects can be dramatic, and again, to the point where we have a abandonment of treatment. So depending on the study you look at, over 5 years, the percentage of women that actually get to that finish line of 5 years using the drugs to the prescribed time that they should, it ranges from, at best, 70% of women, and in some studies it seems to indicate that they found that even in the 50%, so almost 50% of women are having to abandon treatment because of side effects. So the side effects are hormonal based. There is a lot of overlap between tamoxifen and aromatase inhibitors regarding the side effects. So they are hormonal based. So hot flash is just the most common one. Those can be mild. They can be super dramatic, like every 30 minutes, dramatic sweating if you're on the workplace. It can be really embarrassing. It can really impact the quality of life. And then certainly at nighttime too, we can have night sweats, which can greatly impact your ability to sleep, creating insomnias, fatigue, and a whole bunch of other issues that come from sleep deprivation. So hot flashes can be dramatic. Mood changes can happen. It can swing from, it depends on the patient, but it can be on one side of things very irritable and angry and anxious, to perhaps the other side of things where you're very emotional and weepy. So moods can be a big issue. Energy can be an issue. Weight gain can be an issue. Libido can be an issue. Vaginal dryness can be an issue as well. And all of these impact quality of life and the different aspects of patients' lives in dramatic ways that can impact marriages, work, the ability to be the parent you want to be, and all of these things. So these classes of drugs, these two drug classes, can really, with the side effects, be dramatic, and therefore this is why we see these numbers in terms of abandonment of treatment over 5 years. Okay. Another big one that is unique to aromatase inhibitors, we don't see this in tamoxifen, is joint pain, and it usually affects the larger joints, the hips, the knees. It can be shoulders, it can be elbows, it can be upper back and lower back as well. So joint pain can be pretty dramatic as well. So we are left with, in some women, a recommendation for a drug that is so much encouraged by the oncologist because there are clear numbers of benefit for decreasing risk of recurrence over the long term. And yet we are faced with, okay, what do I do though? Because it's really wrecking quality of life in dramatic ways. So what do we do? And what can we do? And the answer is we can do so much. And so I just want to encourage all of the ladies that are maybe struggling on one of these two groups of drugs. There is so much that you can do to increase tolerance and get you through. So I wanted to walk you through some of these things. Hot flashes, certainly. There are so many things that you can do for hot flashes. There are some dietary pieces that we walk our patients through. There's some clear ones. So for instance, high sugar intake, high caffeine intake, alcohol and wine can trigger these hot flashes as well. So you want to avoid all of these. And so there's some dietary pieces to this. Another big piece as well is certain herbs. So there's certain natural compounds that we know can really impact hot flashes. I'm in my practice today now, and there's really not, I don't care how dramatic the hot flashes are, I'm not too concerned that we can't get them under control. There are 4 or 5 options that we use. Every woman's physiology is different, so there is trial and error, but we try to hit the first pitch. So I'm using the 1 or 2 natural compounds that come through the most often for my patients. And you don't have to wait too long. It's usually 2 or 3 weeks of trialing them to see the impact. And if they're not really coming through for us to the degree that we need and we want, then it's just a simple switch to another one, and then we see. And we usually get the right key and the right lock there, and help our ladies certainly claim better quality sleep with night sweats, and then through the day as well, really decreasing frequency and intensity of these hot flashes. Joint pain. Certainly in the studies and the trials that have come out, even though we don't feel like it because the joints are hurting, but exercise, staying active, has been shown to decrease the intensity and severity of joint pain on aromatase inhibitors by 20 to 30%, which sometimes can make the difference to tolerate things. But the majority of women benefit from keeping the joints moving rather than a sedentary lifestyle. Other things we look at is inflammatory aspects to your diet. You can look at certain herbs as well, and anti-inflammatory herbs. Both tamoxifen and aromatase inhibitors, though, are highly vulnerable to drug-herb interactions, though. So you can really change the effectiveness or even worsen the hot flashes and other side effects if you're using a wrong natural compound, particularly herbs. So you need to be careful, but there are anti-inflammatory herbs that you can use. We often use turmeric as well, really good quality, higher dose turmeric, which can have an impact on the inflammation of the joints as well. So joint pain we work towards as well. Mood changes, it really does depend. There's a bit of trial and error here, but certainly there are certain natural compounds that can help with anxiety and irritability, inositol, L-theanine. There's some really nice amino acids. They're very easy to use, not a lot of issues, no side effects, no tolerance issues, no dependency issues. Depression, we use some options like L-tyrosine, which we would use more for depression and apathy and low motivation. When it comes to other aspects like weight gain, vaginal dryness, there's a lot of good solutions for these as well. So we just wanted to let you know today, any lady that's out there that is going through treatment with one of these classes of drugs, the tamoxifen or the aromatase inhibitors, that there's a lot of options when you incorporate integrative medicine into your care. I want to underline though, please, you should really be working with somebody who's very well experienced in clinical oncology. It's their focus. Again, there's a lot of things that a lot of natural compounds that can interact with your therapy. We don't want to use anything that's taking away from what you and your oncologist are trying to accomplish together with the use of these drugs. We want to get the full benefit from it, and at the same, we want the best of both worlds. We want full benefit and you tolerating it well. So you need to work with a naturopathic doctor who really knows what they're doing, and also that the natural compounds fit your overall case, and really make sure any other medications you're on, that there's no interactions there as well. So, and then another piece that certainly when ladies are in this, what we call survivorship period, where we are using one of these drugs to decrease risk of recurrence long term, you are also in a period of time when you are in a great time to consider some other things. And here at Oster Oncology, we also would walk you through some other aspects of things that you can do, lifestyle, nutrition, and targeted supplements as well to decrease risk of recurrence in your case, which is what we're shooting for in this time period for you. And so we would want to just give you the best of the best, evidence-based, really strong protocols we put together so that you feel super confident that other aspects that we know correlate with recurrence risk, we know this from the research, from the published data, that you are also checking off all those boxes as well, okay? So from Oster Oncology to all the ladies out there, again, it is Breast Cancer Awareness Month. We really want throughout this month to put up more videos to really enrich your understanding of your case, the therapies you're on, how to tolerate them, and also additional aspects to help you fight stronger and fight smarter. So if you have any questions about this video, please contact us. You can subscribe to this video as well. Share it as much as you can if you feel like there's people that could benefit from it. You can visit us at www.osteroncology.com. There's other videos there, there's other resources there for you, and of course you can contact us directly as well. So please don't hesitate if you feel like you wanted to reach out to us. We'd love to hear from you.